Good evening, everyone. Welcome to today's Cell Talk webinar. Today, our speaker, Huma, will be delivering a topic on lower adherence to a Mediterranean diet in associated with high adiposity in community dwelling older adults. Results from longevity checkup 7 plus projects. Uma Rakshita is a research trainee at Renex Life Sciences. She is working on the gene maps project, which involves data collection related to gene panels and the literature search for gathering information related to gene associated diseases and its treatment. She has done a Doctor of Pharmacy program from Nirmala College of Pharmacy, Mangalgiri. Before joining Renex, she worked as a drug safety associated in Pharma Consult Private Limited for the project company code datasheet. At Renex, she got an opportunity to gain a knowledge in scientific writing. I welcome Uma to deliver the topic.
Yeah, thank you, Chaya, for the introduction. For today's Cell Talk activity, I'm going to present the research on lower adherence to a Mediterranean diet is associated with high adiposity in community dwelling older adults, result from the longevity checkup 7 plus project. The topic selected is longevity, and the article was published in the journal Nutrients, which has the impact factor of 5.9 and published in the year 2023. This research has impact on obesity, cardiovascular diseases, diabetes. Starting with the introduction, excessive fat accumulation leads to high adiposity, causing negative health outcomes, which is a major public health concern at all stages of life. WHO estimated that global prevalence of obesity has increased threefold and affecting more than 650 million individuals worldwide in 2016. According to World Obesity Federation, more than half of the global population will be overweight or obese in the next 12 years. Two main modifiable contributors of the excess adiposity are physical inactivity and unhealthy dietary habits. Adipose tissue accumulation infiltration leads to endocrine, cardiometabolic, and other functional alterations in the body. The Mediterranean diet is considered as a healthy dietary model because of its known beneficial effects on various chronic conditions like cardiovascular disease, diabetes, cognitive decline, osteoporosis, etc. This is a Mediterranean diet pyramids, which is characterized by high intake of fruits, vegetables, nuts, and legumes, a moderate intake of milk and dairy products, a sporadic intake of meat or animal fats. Coming to the general background, BMI is most commonly used metric to estimate the adiposity in general population. But some studies have suggested that BMI doesn't have enough sensitivity to estimate the fat on individual basis. And it is also stated that the association between BMI defined body obesity and negative health outcomes in older adults is controversial. Hence, a novel body fat estimators based on anthropometric measures have been proposed and validated. Among them, RFM, that is relative fat mass, was proved to be more accurate than the BMI in estimating the body adiposity and reducing the misclassifications in adults of different ethnicities, especially in older individuals. Present challenges of the study. Several studies have highlighted that MediDiet helps in preventing and managing obesity, but the information was captured from the young or middle-aged subjects, and a very less information was available from the older adults. Furthermore, no studies have explored the association between adherence to a Mediterranean diet and anthropometry-based indices of body adiposity in older individuals. Coming to the objective of the research, the main objective of the study is to assess the prevalence of high adiposity estimated by RFM in Italian community dwelling older individual and explore its association with adherence to a Medi-diet. Methodology. The data used in study was collected from longevity checkup 7 plus project. Inclusion criteria includes the participants who have the age of 65 or above, and exclusion criteria includes the subjects who has self-reported a pregnancy or the subjects who have refused to undergo capillary testing of cholesterol and glycemia, or who are unable to provide informed written informed consent form. And the participants were recruited in public places such as shopping malls, pharmacies, and some health camps. To ensure consistency throughout the study, all the assessments were conducted in a systematic sequence, like lifestyle interview, measurement of blood pressure, body weight, height, capillary testing of cholesterol and glycemia, physical performance test. Anthropometry and lifestyle habits. A questionnaire on dietary and other lifestyle habits was prepared and used to collect information on personal characteristics and to estimate the modifiable risk factors for chronic diseases. Other parameters like weight, height, BMI, waist circumference, and physical activity status were also estimated. To define smoking status, two categories, that is active smoking or and past or never smoking, were defined. Relative fat mass. To estimate relative fat mass, Woolcott-Birchman equation was used. In this equation, it is considered zero for men it is considered as 0 for men and 1 for women for sex. If the RFM value is more than 40 in women and more than or equal to 30 in men, it is considered as high adiposity. Adherence to Mediterranean diet and daily energy intake. Nutritional data was obtained using a simplified food frequency questionnaire. Adherence to Medi diet was determined using a Medi Light scoring system. This Medi Light scoring system includes 9 food categories. The foods which are most commonly included in Medi diet were given the score from 0 to 2. If the diet that categories that doesn't include in a typical Medi diet were allocated 2 if it is taken in low amount, and 1 if it is taken in moderate amount, and 0 if it is taken in high amount. A summary score of 8 or lower indicates low Mediterranean diet adherence. If the score ranges between 9 to 11, it is considered as moderate adherence, and if the score is 12 or above 12, it is considered as high Mediterranean diet adherence. Mean daily energy intake was calculated as a sum of calorie content of standard portion of individual food items listed in the uh, food frequency questionnaire divided by 7, that is the days of a week. Coming to the results, a total of 2,092 participants were included in the study. The mean age of the study population is 73.1 years, and 1,117 were women. Adherence of Mediterranean diet was low in 346 participants and moderate in 1,198 participants, and it is high in 481 participants. Individuals who have low Medi diet adherence was predominantly women and were more frequently active smokers than the other two groups. Daily energy intake was high in participants who have high adherence to Mediterranean diet than those compared to moderate or low adherence. BMI values and waist circumference were low in participants with high Mediterranean diet adherence. And also the mean RFM value was 39.6 in women and 29 in men, and was significantly lower in individuals with high Medi diet adherence. High adiposity was found in 971 participants and was more frequent in those with low or moderate Medi diet adherence than in high adherence group. In this picture, we can see that the participants who are having a high adherence to Mediterranean diet were having high Medi diet score when compared to other two groups. Similarly, the participants who have high adherence has the lowest BMI compared to other two groups. Here also the waist circumference and RFM values were less in the group having higher adherence to Mediterranean diet compared to other two groups. Discussion. High portions of plant-based food and less portions of meat and dietary products are main contributors for the positive effect of Medi diet on body fat accumulation. Medi diet majorly consists of plant-based food which is rich in fiber, providing low density and contributing to greater satiety. Medi diet also increases the diversity of microbial in the gut, which is associated with reduced inflammation and oxidative stress. Finally, the health benefits of Medi diet is believed to be because of both nutritional factors as well as lifestyle and socio-cultural influences, including engaging in regular physical activity, adequate rest, and conviviality. Limitations of the study include the cross-sectional study design prevents to draw the conclusions of cause and effect because of between the adherence as well as the between the adherence of Medi diet and adiposity. Exclusion of substantial number of participants due to incomplete data, and there is no data on alcohol consumption. Lookup 7 plus data did not include information on disease conditions, medications, and socioeconomic status. All the participants were Caucasians, thereby results may not be applicable to other ethnicities. The study mainly focused on older people. Conclusion. This study indicates that there is significant correlation between a higher Medi diet adherence and decreased levels of body adiposity in a larger and relatively unselected sample of older adults residing in the community. Impact of the research. This study suggests that the need and the importance of dietary modification in our daily life in order to reduce adiposity, which is a major risk factor for health conditions such as obesity, cardiovascular disease, hypertension, and diabetes. Thank you, one and all. And you, for any queries, you can find me at uma@renix.org.
Thank you, Uma, for your detailed talk. I don't see further questions from the audience. Thank you, Uma, for answering the questions. Can you move to the last slide? So before I conclude this webinar, I would like to inform you all that next presentation will be given by Jai Godara on 26th June 2024. The topic is healthy lifestyle and life expectancy at the age 30 years in Chinese population, an observational study. So thank you for your kind attention and for joining today's webinar. We appreciate your time and engagement. We hope to see you in the next webinar. Thank you.